I was really hyper-focused on, are you going to be truthful? And are you going to give me all the right stats? But the first sentence said, I'm really sorry to hear that your dog was just diagnosed with cancer. And again, it really made me pause for a second because I was like, holy shit, this thing just showed me a ton of empathy when I didn't ask for it.
There's going to be a generation of pet owners that are completely immersed in interacting with these tools, like sharing what we would consider to be more confidential information or going to them for support. I think will look very different in the next kind of 5 or 10 years.
We are going to be able to not only personalize care, but dramatically improve the accessibility of care. And that to me is really like the promise of AI. It's like personalization at scale. Hey, welcome back everyone for another phenomenal action-packed episode of the Veterinary AI Brief. We have a treat for you here today. Dr. Christopher Pinard, a boarded oncologist, to talk about all things AI and oncology. I am especially excited to dig into what AI means for his day-to-day work as an oncologist. And then Chris is working on, a really interesting venture that brings a scientific rigor and data-based validation of AI tools in veterinary medicine that I think, as we see this field progress, we're not only going to see more veterinarians using AI in their daily work, we're going to see way more tools coming on the market. And so it's going to be very helpful for you, the listener, to be able to ask better questions, to be able to understand when a tool is truly transformative or when it's marketing. And so Chris is going to be helping us do that here today. And we have a very warm welcome back for our very own Aaron Massacre, who was off at his fancy Parisian re-wedding, I think his wife called it. So Aaron, just a couple statements for you. One, welcome back. Two, how dare you?
Thanks, guys. Great to be back. Always a loving environment here on the podcast.
Aaron, what are you hoping to get out of this episode?
Yeah, so being somebody that doesn't come from a medical background, it'd be really interesting to hear, what does this actually mean for people? So what does it mean for the people who are practicing vet med? And then what does it also mean for the people who are animal owners that are out there that might be listening to this? Those are the kind of big things. And then maybe secretly, I want to learn a little bit more about his company so that we can eventually buy it or take it over or something.
There's the collaborative spirit that underpins the entire veterinary profession. Aaron, thank you for being such an ambassador and steward of the types of relationships we like to build with our guests, creating a welcoming and transparent environment. Yeah, maybe a couple of things that would be awesome, and then happy to give Chris a little bit of a background as well. So obviously coming out of the last few episodes, we've been engaging with people in the profession that are using these tools in their day-to-day lives and kind of working with them, not just as a consumer and user, but as a developer, as a creator. And I think Chris in particular has a really interesting perspective coming from a specialty that is undergoing a pretty significant transformation. Like when I was a vet student and even before, like the oncology service at the Ontario Veterinary College was just growing, a couple exam rooms, and now it's got its own building and it has expanded rapidly. And with that, a lot more pets are getting more advanced care. We're seeing some of those diagnostics shift towards the primary care. And so it's a specialty that's really poised for a lot of transformation. And with that, I think acceleration through AI. And so that will be really fascinating. And maybe as a way of background to Chris, so Dr. Pinard not only is a medical oncologist trained at the Ontario Veterinary College, but did his graduate work looking at the relationship between breast cancer and immuno-oncology, that translational medicine perspective. And so we're going to get into what are some of the systems and frameworks and infrastructure that maybe exists on the human health side that we don't yet see on the veterinary side, and where are there differences and opportunities. In addition to being kind of a practicing oncologist who's opening a new practice himself there and kind of going through that journey, recently started a new company called Animal that's looking at bringing some of these evidence-based solutions. And I like to think that his biggest claim to fame is that he was one of my first students on the Dr. Little rotation of technological excellence. And unlike me, who had an interest in oncology when I started vet school, but then ultimately went on the technology route, Chris said, hold my beer, and decided to do both of those interests in parallel at the same time. And so with that, really excited to dig into it. Welcome to the show.
Sorry, just one thing, because so many people are listening and not watching us right now. For our audience, Adam is currently wearing a shirt that says mentor on it right now.
I think he's that tattooed like it's a tattoo.
It turns out after a couple of lawsuits, I am not legally allowed to call myself a mentor for any of the students that I thought I had any positive influences on. But thanks for clarifying that, Robert.
Can we just talk about how you possibly survived a rotation with Adam? You went through and you still wanted to be a vet. And it's actually the opposite that happened. So that's amazing.
I still remember, this is, well, first and foremost, thank you guys for having me. I'm just super excited, honestly, to finally chat with all of you except for Adam, because, he and I have actually hung out before, like he mentioned, or I should say he mentored me. I do have a tattoo that says I love Adam on my lower thigh, which he still hasn't seen yet. But so I appreciate being here and being able to give my sort of lens, but I think what's really great about the group that you guys have here is everybody brings a different piece to the table. And that's why I've enjoyed listening to the podcast, and I'm just excited to be a part of it. But I'll tell you one story from the first rotation I ever had with Adam. I just remember the first day I was super excited, and he was like, Chris, I'll meet you outside your place. And I think I was in the loft at that point, Adam. I can't remember exactly. And he came whipping around the corner because we were like 15 minutes late, whipping around the corner in this like old Honda or something like that, I remember. And he's like, oh, Chris, let me just move this stuff for you. Move like 16 bags of something rather, chewing on an apple. And he's like, all right, let's get the hell out of here. And that was, basically the metaphor for the rest of the rotation. So it was great. It was a good time. But it really convinced me that being an entrepreneur and having that flexibility to do whatever the hell you want is actually really empowering. So thanks for that, Adam.
I'm glad you can learn from my mistakes. Maybe it would be helpful for the audience to kind of frame up your journey and how you got into not just oncology, but this kind of more specialized interests in this field, and would love to kind of connect some of the dots in your background that we shared in the intro.
Yeah, of course. So, I mean, like everybody else, like my journey to vet med started like any other veterinarian. Oh yeah, I love animals, always want to do that, but did my training at Guelph as you all reiterated, and I ended up going away to Colorado State University for a specialty internship after doing an internship here in Toronto before I did my residency at Guelph. And I will say, being at CSU and working through with a lot of groups there on their comparative oncology program was a really, really interesting piece, because that was the first time I think I really saw the impact. And I think, to your point, Adam, why oncology has blown up so much is this potential idea that we see this increasing rate of cancer in our patients, and they're getting all the same cancers that we have. And the more we look into it, the more we're finding the similarities, and they're really becoming that baseline to be able to test and deploy, for lack of a better description, any sort of medical therapy before we jump into the human space. And, one of the greatest studies that we were working on there at that point in time was we were utilizing, losartan mixed with palladia. So losartan being the repurposed old blood pressure drug. And we actually watched pulmonary nodules and osteosarcoma melt away. And it's amazing because now that's being translated to children with pediatric osteosarcoma. So that really solidified my mind of not only oncology is kind of fun and really cool, but also this idea that there's a lot of translational approaches, and it's a really cool specialty that gives you an opportunity to really do that. And I think it's just, everybody loves the C word. Everybody loves talking about cancer. I think there's a lot of money in cancer, obviously, from a funding perspective. So it's a really great place to be if you want to be entrepreneurial or try something new. And it's part of it because you're trying to beat a crappy disease. But anyway, so after that internship, I went back to Guelph for my residency. And near the end of the residency, I actually had an opportunity at Sunnybrook Research Institute here in Toronto, which is one of the human hospitals that does a lot of pioneering research in general, but AI research as well. So I was with the Tran lab there, and we basically looked at sort of what you alluded to in the intro is immuno-oncology, so how the immune system is interacting with cancers. specifically in women with breast cancer, and using an artificial intelligence workflow with pathomics or pathomics and looking at pathology. And we wrote a paper at that point about translational oncology and the incorporation of AI to that. And then from there, basically my trajectory kind of went off where I'm now an adjunct professor at Guelph, so I have the ability to carry on research. I live in downtown Toronto, so can't be a professor at Guelph, but I get the full opportunities of doing research with, people like Ryan, who I know you guys had on the podcast recently, and a few other different people. And that really sort of accelerated my journey into AI in the veterinary space. And then one day, I took one of the classic AI online courses and was coding in Python and was talking to my professor at the time, Dr. Quan Chen Wu. And he's basically like he's been around the block. He's got his MBA, he's got mechanical as well as like all computer engineering degrees that you could think of. He's got more letters than I could ever dream of. But one day he and I were working actually on a protein folding project where we were using artificial intelligence to fold proteins in a obviously artificial environment, which could be used for drug testing. Nobody had applied those human algorithms on protein folding to the veterinary space. And so we were utilizing that for the first time and taking a look to see what the performance looked like. But I kept missing meetings, unfortunately, because I was trying to prep for cases the next day. And that's where the whole idea of starting a company came from. And he and I actually aligned together and we said, we want to do research in AI. We want to make a product that veterinarians like to use. And that's really how we built out the company. And it's kind of just expanded from there.
I haven't been busy at all, eh?
What's that? No.
It hasn't been busy at all. Sorry, Robert, go ahead.
I think there are a couple things to dive into there. One, just a disclaimer, point of clarification. Chris and Aaron are actually competitors, and off camera, they got into a yelling match. And so it's just something that we're going to try to keep things civil here for your sake, the audience, but just something to be aware of. The second thing is, Chris, it sounds like, your background is absolutely fascinating. Like the amount of research that you are bringing to the table here is, I think, hugely exciting for us and our audience. I'd be really curious about a couple things. One, it sounds like you're pretty clued into the world of how is AI accelerating research for the C word, which I'm also rather fond of, maybe different reasons. And second is what are the gains that you would expect that the industry should know about maybe in the next few years, especially, in a way that can practically impact them?
I'll start more on the human side and maybe we can kind of jump in and bounce around a little bit. And just so the audience know, Aaron and I didn't actually fight. Like, he did order me this beer, just taking note, it's actually a bubble tea. But no, so from the oncology side on the human space, and again, knowing my little bit of bias about being at Sunnybrook Research Institute, you have to remember of like the big pillars of oncology, right? You've got radiation oncology, medical oncology, surgical oncology. And I think when you take back at a 30,000 foot view, it's like, yeah, sure, you could integrate AI in every single one of those. But think of being at drill into a specialist level as a radiation oncologist, for instance. They've been using algorithms and honestly AI technology for years and years. Even veterinary radiation oncologists have. Because every time they plan for a radiation treatment, they have auto segmentation that improves their workflow. That's an AI algorithm. They've been using that for over a decade. That comes with the machine that you buy and the software that comes with it. It's just now we're seeing, segment anything models and things like that come out now that are just available to the public. So that's like one very simple example of a workflow for a radiation oncologist that helps the radiation oncologist. From the medical oncology side, I think it gets really interesting, obviously, because I'm a medical oncologist, but this idea of personalized care. And that word has been thrown around a lot for, again, probably close to a decade. And I don't think we've really actually been able to really popularize it to a point that it actually makes an impact. But one of the things that we were looking at the Sunnybrook lab was this idea of chemotherapy is toxic. You make people really sick. And if we can predict with a relative certainty based on your histology, for instance, if you're a woman with triple negative breast cancer, and we know that you're not going to respond to doxorubicin, let's say, why the hell would I give that to you? Why would I make you sick for that reason? And so I think that's actually a really cool case of if we can predict with a certain level of certainty of what you're going to respond to beyond just genetics, but other factors that are related to that, now we treat with purpose, which is really interesting, and with hopefully success. So hopefully that type of prediction capability is going to help us with treating patients better. The other thing that's really interesting is now that immunotherapies have come out into the not only veterinary space, but there was some of the work that I did in bladder cancer in dogs was all focused on something called the programmed death receptor. And just for a little bit of background, basically, right now, tumors are really smart. They can stop your immune system from killing them, which is how they stick around for so long. What you can do now is you can actually reverse that immune blockade, and you take your foot off the brakes, and now you allow a full-blown immune response, and you can kill off tumors. And so those drugs were really popularized in the human space. They're now coming to the veterinary space. So once again, that just all comes back to this level of personalized care that we're going to be using algorithms, AI algorithms, to predict sensitivity to drug and hopefully reduce toxicity, increase success, and hopefully outcome. And then I think really the last really interesting piece, which probably correlates with some of the stuff that Ryan was talking about, specifically about radiology, but more as it pertains to oncology, we're seeing these new things come out now called radiomic scores. And effectively what that means is you can take a patient's CT scan, for instance, and we're just starting to sort of brush this in veterinary medicine now, but you can take a patient's CT scan and you can take a look at a tumor and you can assign it a radiomic score based on sort of the gray level pixel interactions. I won't get into all the details unless we want to go there, but effectively, what we use on a clinical basis is called a nomogram. So oftentimes we look at tumor size and mitotic count and all these other things, and we assign patients a score, and that's associated with better outcomes or worse outcomes. What they're actually finding now in the human space is that, particularly like lung cancer, for instance, is you can take all the traditional lung cancer prognostic factors plus add in a radiomic score, and based on all of that information, we are now much, much, much better at predicting a patient's outcome because of that added radiomic score than when it was removed.
You were talking about how there's a lot of ambiguity as to when it should be used and when it shouldn't be used. And then you kind of hinted at this idea that there will be this kind of idealized future wherein it will be a much more clear pathway. What do you think it's going to take in order to narrow that in so that not only is there greater consensus around when these particular therapeutics should be deployed, but also when people are going to be more comfortable with it?
It's a really good question, Aaron, and I hope it doesn't seem like I set you up for that question, but the reality is that it's actually already happening. So I don't know if you guys have heard of the company Impromed already. They have a few advisors like Doug Tham and a few other oncologists that are on board with them. I believe they're a company out of South Korea, if I remember correctly. But some of their group, I've met a few of them at the conferences, but also obviously read their literature, and very evidence-based. And it's very, very cool what they're up to, because what they've done specific to lymphoma right now, but obviously I think they're going to expand this in the future, is you can have a dog with lymphoma in front of you. You, as a general practitioner, can send this sample out to them, and before you're even headed to an oncologist, they will give you diagnosis, they will give you type, and they will also do in vitro testing on those cells. So they grow it in cell culture. They look at sensitivity to drugs and apply an algorithm that actually helps predict which drugs in the CHOP protocol, the standard for canine lymphoma, which drugs that patient is actually most sensitive to. So I guess the reality is that it's already here. It's already starting. I think the barriers to entry right now are, one, we need proof of and data. I don't think we've got enough data or enough data sharing happening to be able to do this for more than one tumor type or more than one disease. And I think we're going to see all these other different companies start to amalgamate at some point. And then I think cost is another big thing.
Maybe to kind of take a step back then in terms of how the oncology space is evolving, it sort of strikes me a little bit like we are maybe a couple steps before where radiology got to, where you had a specialty that before the digitization of a lot of those key processes, it was expensive and inaccessible, and the amount of collaboration was limited. And all of a sudden you made kind of you ended up digitizing that process. You really empowered the GP to be able to offer that to more pets with that, we had this huge influx of cases. And it's really interesting to see maybe how that's getting stretched, where we're able to do more on the specialty side, but on the other side, kind of reach more patients through this more distributed model. I would imagine for something like oncology, that's massive. Like you're talking about hundreds of pages of records. It's not the same as just like one radiograph, and not to like diminish the amount of information that gets passed, but those cases are managed over a significant period of time.
We realized very early on that unless you're working with a big conglomerate right out of the gate, you need your own data to be able to train your own model. And so we pivoted for the first 6 months and built a consultation platform. And I have to say, I'm the busiest practitioner on that. So your model of and thought around remote care or remote consultation with oncology, yeah, I think it actually very much mimics radiology in that sense. Because I get vets all the time through the platform that it's not even that cost is a barrier, not even necessarily that distance is a barrier to an oncologist. The owner is just afraid to make that jump because they have a lot of presumptions about what oncology care looks like, and they need the education, and they want to see what an oncologist has to say before they even start even remotely thinking about treatment. And I wanted to show you guys as well, because it really triggered in my mind one of the other projects that we got funded for, more associated through Guelph, but through the OVC Pet Trust, was actually utilizing iPhone LiDAR technology to scan oral tumors and create 3D representations of that tumor. And one of our ideas around that was to increase clinical trial access for families. So you can imagine a day where I can now remotely monitor a patient because we can scan the tumor. We can get a 3D idea of what it looks like in the oral cavity. I can send them a brand new drug via mail to their door, and their veterinarian can help us with remote monitoring and can also help us with side effects and management and all that. And I can be their guide while the owner is able to actually track progress from the comfort of their home and upload that to a portal. And we took that even a step further, and we've now taken a look at just using standard computer vision. And I'm just going to share a presentation that I'm going to be giving in just a couple of weeks at VCS, or the Veterinary Cancer Society. But we've actually started developing automated algorithms for tumor detection. So these bounding boxes around this tumor is a segment anything model trained on only a very small data set, about 50 cases of oral tumors with multiple different images per tumor. But you can see the ground truth assessment, which is my assessment, versus what the bounding box is able to actually detect automatically. And you can take that even a step further, and you can actually see in these images, this is an original image, but they actually have a predicted mask around the tumor now. So now we can get contour. We can get an idea of tumor volume, estimate tumor volume. And again, this is using an algorithm. This is not done by hand. And then on top of it, just like you would extract radiomic features, imagine if I was a veterinarian, primary care veterinarian up in Sudbury, and I could take an image of this mass for an owner, and with 98% certainty, I could tell you what the histology is, and I could also tell you what which drug it's sensitive to, even without a biopsy. That's the future of oncology. And that's the future of accessible care. And I do think that in our lifetime, in the next, probably, I would say 5 to 10 years, we're going to see that become much, much more commonplace.
So you're saying that with the computer vision technology that you're using, you're able to identify the tumor?
In that study that I'm showing you guys right now, that is literally just using computer vision to detect the tumor. And that's all we've gotten to at this point. We are far away yet from predicting histology and, outcomes and treatment and everything related to that. But to that point, Aaron, I think it's actually a really good segue into, I do think that there is a point here of, I want to be able to offer that to families where they can remote monitor or they can remote identify a tumor without having to put their dog through X, Y, or Z in terms of biopsies or paying for those things. But it does come down to trust. It does come down to confidence in the data set. There's a whole bunch of other problems and issues that come with it. But I do think, it is going to be a cool future.
We are going to be able to not only personalize care, but dramatically improve the accessibility of care. And that to me is really like the promise of AI. It's like personalization at scale, basically. And I think one of the reasons that's so interesting, and you made a really good point, that we're going to have to look at the entire pipeline and drive costs down. one of the risks of AI is job dislocation. And, we haven't really talked about that all that much on this show yet. And I think it's probably something that is not all that close to the public consciousness, but we could very well see a day where entry-level jobs for knowledge work are completely wiped out. And there's actually interesting, compelling data saying that that's kind of started to happen right now. And so what's going to happen when we have a significant amount of the country who is suddenly out of work, and what are the implications for veterinary care? And so to me, it seems like this really fascinating race where we need to not only develop the kind of top end of care, but really increase the floor as well for the people who might not have nearly as much to spend on it. Now, one other thing I'd really like to do and dig into here is I think you've done a really good job of talking about what's on the horizon. How does this change the way that we use these tools like today? Like what should our audience be doing today? And so one thing, I do not have the medical background that you have. We're really like I moonlight as a CEO of Digital Empathy when I'm not podcasting, and we do like marketing, communications, tech, that sort of thing. And one of the ways I think the industry has really fallen short is like social work for, like caring for people whose pets going through cancer. It is a lonely, scary, terrible thing. How do you think about the current applications of AI and really how we can leverage that to treat the underlying problem statement of like, hey, this person's just received a very scary diagnosis for the pet that they've loved. So many people out there kind of have the emotional burden and journey of caring for a pet with cancer kind of to bear on their own.
Yeah, and it's all a really good question, Robert. And I've got a study that I want to show you guys. This, again, it's going to be presented in a couple of weeks at the Veterinary Cancer Society. And I always ask this question: does artificial intelligence have more empathy than we do? And that's simply because in this study, this is from JAMA Internal Medicine, so human paper. But effectively what they did is they blinded a Reddit thread to patients. And they took human physicians and randomized assignments to answer clinical questions for patients. And then on the flip side, they used an artificial intelligence chatbot to answer questions. And what you can see on the graph on the right is, at least from a perception to the patient, not only were the responses more readable to the patient, they seemed more empathic to the patient if they were written by a chatbot rather than a human being. When I read this paper, it really made me pause for a second about what's my current state of burnout? How am I feeling? How am I interacting with my clients every day? What are my pain points and what am I feeling every day? And I think I'd love to dive in a moment too about the state of a profession and mental well-being, because I think there's actually some very interesting work being done on chatbots for mental health and medical professionals. We have clients come to us all the time, and rather than saying, hey, I Googled this, they used ChatGPT and they interacted with a chatbot before they came to see me. And that's not just for information. I think that's for emotional support and well-being, just like you're saying, Robert. And I remember I did give a presentation maybe 2 years ago now. And one of the things I did, this was with ChatGPT, I think it was 3.5, if I remember correctly. And I just pretended to be a client. And I said, hey, my dog's been diagnosed with osteosarcoma. Can you give me some information about it? And it was really interesting because yeah, sure. Like I was really hyper-focused on, are you going to be truthful? And are you going to give me all the right stats? But the first sentence said, I'm really sorry to hear that your dog was just diagnosed with cancer. And again, it really made me pause for a second because I was like, holy shit, this thing just showed me a ton of empathy when I didn't ask for it. And that's a really nice, I'm going to call it a feature, I guess. We all laugh, I think, at the movies and, the way people interact with AI or love. What's the movie? Her? Did you guys ever see that movie? Yeah, like we laugh and it's sort of a part of pop culture. I think it's real. I think it really is real.
It also, I think, speaks to this idea that there's going to be a generation of pet owners that are completely immersed in interacting with these tools, like sharing what we would consider to be more confidential information or going to them for support. I think will look very different in the next kind of 5 or 10 years, in the same way that, like, if I got my grandma to try to book an Uber, she'd be like, what are you talking about?
Yeah.
Right. And so I think that's really interesting. There's like a couple interesting threads that were through some of your responses, Chris, that I maybe wanted to unpack for a second. So one is like this degree of kind of self-awareness, or maybe like recognizing the limitations of humans in order to like advance a field. So if you're a veterinarian who's like, oh, I'm always going to be the best at diagnosing, I'm always going to be the best at doing this task, or I'm going to be the best communicator, as opposed to maybe looking and saying, well, actually, like I've never seen these cases before, or I don't have time to spend an hour personalizing this plan or getting on the phone with an owner. Like, I think one of the themes between yours and Ryan's talk was like really recognizing that, look, in order to like provide that experience to the client and provide the best care to the patient, we're going to have tools that are able to augment the areas where we're weak. But if you don't think that you have any of those limitations, your ability to be coachable, to upskill is going to be limited. So that's kind of one piece. The second part, and I feel like you might have maybe a different opinion on me, but I think one of the things that's maybe a feature and not a bug of the veterinary model today is the ability for primary care to rapidly absorb and deploy new advances of care, right? So primary care is not this kind of defined rigid box of tasks, right? We see practices that are able to say, look, I want our staff to learn ultrasound. So we're going to like learn this skill and then we're going to start deploying it, marketing and selling it. Oncology, you talk a little bit about some of the pieces there to get a practice to go from, hey, we're not comfortable offering this service or maybe providing that continuity of care to we certainly are. And that kind of free movement and that ability for new advances to be distributed and democratized, I think is a really important element of veterinary medicine. We don't necessarily have the same regulatory constructs, but we have a number of, I think, existing models and how you build that trust with the practitioner community over time. As that moving forward in a world in which AI is accelerating all these pieces, like, does that scare the shit out of you? Does it leave you excited? How would you think about guardrails around that? Or do you think there are previous models of, hey, Zoetis, IDEX, whoever is going to publish this paper, and now we just adopt that diagnostic test and we're all good with that model? Like, what does it need to look like in the future?
Honestly, this might take me a minute to get through all of it, because I think it's a loaded question, right? In terms of the current state of affairs. And I think we're fully aligned, Adam, in the sense that the entrepreneur in me, the CEO hat on, I love this idea that vet med is so unregulated that we can jump in and just start playing. It's a wonderful sandbox to be in. And I think translational oncology, comparative oncology, it is honestly like the gold standard representation of that. We are treating dogs that are not lab mice that are developing real diseases in front of us to translating to a hospital for sick children that are now being treated for the exact same disease because we studied it in dogs. That is a beautiful thing that we have available to us in veterinary medicine that I think in truth is underutilized. And again, because it's the C word, it's the only reason that it really gets pushed through the pipeline. And I think in 10, 15 years, every facet of veterinary medicine, whether it's cardiology or internal medicine or neurology, we're going to start to see a lot more comparative medicine come to light once the human professions start jumping on board.
I think that there is this overarching question, which is, does the model change dramatically? Can these advances be integrated into these existing models? And so now every practice like offers these new skills, or you end up creating completely new models that are really AI first or whatever. But like you look at human health, man, and they have these like concierge models. And it's the idea that, hey, we're going to take what today is a really difficult, cumbersome process across 10 different doctors, and maybe you don't get those tests, maybe not, versus we're going to give you like a subscription fee. You get all these tests. We have one primary kind of clinician that quarterbacks everything. And I wonder about the ability for today's primary care model to absorb all the advances that you're talking about in one specialty, let alone all these other pieces, let alone when they have their existing kind of way of care. And so I'm just curious, like, what you think kind of happens there. Does every practice like just become able to provide cancer treatment and cancer diagnostics, or is it like specialized pieces, or what? Maybe it's a hybrid of a bunch of approaches. I'm curious what you think about it.
I honestly think if there's any technology out there that has the capability to do it, it's artificial intelligence. Because, even as I'm sitting here just sort of brainstorming while you were talking, like, I think on one side, again, just pure oncology lens, there is an ability for me to be completely remote and support, and or for me to be out of the loop until somebody really needs me, even today. With the drugs that we have available, they're very limited, but I think that's only going to increase. There's a new drug, Tigranol Tigliate is the fancy name for it. It's an injectable that you inject in the tumor, and it's available to licensed veterinarians, whether you're a general practitioner or oncologist. Palladia, as long as you got a license, you can prescribe it. So there is nothing stopping GPs other than their comfort. And if they've got an agentic workflow that could help them feel more comfortable, give them the information that they need to inform the client, or the client already comes informed before they walk through the door and they just want to pay for that treatment, 100% that's going to do it. But, the other side of it is too, when we think about imaging, like, a cardiologist, for instance, right now today, the only person who can do an echo is a cardiologist. I'm telling you right now, there's already algorithms in the human space that are automatically calculating, ejection fraction, the left ventricular size, ECG waveforms. Our specialty is going to be a thing of the past. I mean, I don't know. Like, I guess what I see a world in is, again, I think there will always be a reason to have a specialist alongside a GP, but I do think the support systems are going to change. There are always going to be people that want to come in person and do these things. There's also going to be always a lot of people that can't make it out, can't afford it, etc. And we're going to need to be smart about the way that we're allowing AI to integrate and regulate how we're actually informing our clients and treating our patients. So I don't know if that really answers your question or causes more thought, but I'm curious to see what you guys think. And back to sort of what Adam was talking about, I think one thing I did want to share is we've done some work internally. This isn't published yet. We are planning to publish it publicly in archive. There's no names named. But one of the things we really asked ourselves in veterinary medicine, specifically about using our technology, which is a medical record summarizer, was this idea of, is the profession okay or good enough or okay enough with GPT wrappers? Or what we presume are GPT wrappers, versus models that are actually built. Sorry,
for our audience, Chris, could you, if there's like somebody in the room with us who uses a GPT wrapper, if you could like name names, that would actually be really interesting.
Yeah, I don't know if I can name particular names, but I will say that for the audience who doesn't know what a GPT wrapper is, effectively that allows you to call an API and run a model off-sourced using something like ChatGPT, but present answers to the front end, which is the user. So it feels like you're using a product for yourself, but really they're using ChatGPT in the back end. So it provides an experience that is really unique to the front end user, but it doesn't provide a model that is unique to the profession.
So I do want to, just make one point of clarity. I say that in jest. I think the term GPT wrapper has actually lost a lot of that was a very pejorative term, maybe like a year or two ago. And now we are seeing a company like Cursor, which at some point would have been considered a GPT wrapper. But the focus on how they're applying the context that they give the model and the tuning that they give the model provides some extraordinary benefit that now if you're an engineering team and you don't use Cursor, you are getting
falling behind
the next outproduced by your
Coinbase fired engineers. They gave them a week to adopt it. Now, something I think is actually more problematic in the short term, which is that this kind of homogenization of a lot of different forms of creation, right? Mm-hmm. So everybody's website, we're going to take the best website. You can take a screenshot of it. Now everybody's website looks purple and, skeuomorphic, whatever, or these logo redesigns and things like that. And I think we're kind of in this weird, I don't know, so it's like GeoCities template era. When you used to make websites, so there's like 5 templates and every website looks the same. That's kind of what AI is doing right now, I think. But I do think what will happen over time is you'll start to see an explosion as more people can do things with these off-the-shelf capabilities that were only available to very specific people before, right? And I think what ends up happening is the previous generation of that specific skill looks at this one and wants to vomit, right? So if you go back, you take a classical pianist, and if they were looking modern music producing with people remixing stuff, they'd be like, well, that's not music. And now you're looking at the people who are prompting AI to create music, and the people that are generating it in the modern way are looking at these prompts and be like, well, that's not music either. And it's well, who's right? It's all different. But along the way, the cost of producing music went to zero, and you need to buy like a $5,000 harp that was only available if you were like the son or daughter of a prince. And now anybody on a phone can generate high quality music, high quality video, etc. So I do think that will lead to an explosion of creativity, but along the way, there'll be a lot of pissed off people.
Yeah.
And there'll be a lot of exposure in areas that we're going to have to rapidly scale up infrastructure, right? Like two things can be true at the same time. Self-driving cars might be the future of transportation, but if your kid is the one that gets run over by the self-driving car, you kind of don't give a shit.
Yeah.
Right. And so we're going to have to really grapple with what I think are going to be some really pointy edges in what this transformation looks like. And yes, in the macro sense, I think it will get better over time. But if you're exposed, or your credit card gets hacked by AI, or your grandma's savings get drained because she gives her information to ChatGPT and that gets hacked, or your kid gets hit by self-driving car, like it won't matter about those macro progress, right? You're not going to kind of turn the cheek because AI over time is going to get safer and better, I don't think. So I it's a bit of a rant, but I do think we have to be thoughtful about there, because if those individual cases end up leading to what you're already seeing in some of these places where they light self-driving cars on fire, or they try different ways to hack them, or people use these systems to exploit a point, and you've talked about prompt injection before, these tools can be used in very nefarious ways if we're not careful. And the surface area and the speed at which that damage can be done is difficult to even wrap your head around.
100%. And I think that's actually probably a really good lead in too to sort of what I was hoping to show a little bit of, which is this idea that when we use these wrappers, part of the problem is I don't think potentially the user population understands the potential implications. And what we do need to ask of the companies, my company included, is, and I say this in every talk that I give, is what guardrails do we actually have in place to make sure that you are protected as the user at the end? And so anybody listening, anybody who's buying an AI product for the first time, that sure as hell better be one of the questions that you ask the companies is, what guardrails did you have in place to protect me? The same way that when you talk to a drug company, you better share every single potential side effect that could in theory occur so that I can inform my client about what happened. We need to be holding the companies to the same regard, my company included. But what I want to show here is this is a heat map. And again, for full transparency, Hachiko is one of our products at Animal, which is a product that was trained on a large group of medical records, started with a few hundred. We're now over 2,600, and specific to the veterinary space across multiple specialties. And what we asked ourselves the question on, because we did an internal study previously where we compared, and to Aaron's point initially about this idea of benchmarking, we benchmark human versus AI. We looked at our summarizer, versus veterinarians and veterinary specialists specifically in their own summaries that they had written. And what we found is that really the crossover and the typical AI benchmarks that you would look at, like F1 score and a whole bunch of other things, was really poor. Like the summarizer looked on paper like it was doing a bad job. But when you actually delved into it further, what you found is that 33% of the time, it was actually picking up things that the veterinarians missed. And so part of the reason for those poor benchmarks was actually because it was doing a better job. And so that's a really interesting point about benchmarks. But what we've done even further than that, and again, this is going to be open and available on Archive, which for anybody who doesn't know is a publicly available, non-peer reviewed literature database out of Cornell that now everybody has access to. But effectively, we took two other commercial products that are currently available that also offer summarization. And to our knowledge, we don't know if they're veterinary trained or not in terms of medical documentation. But what we found is that our models that are developed specifically for the veterinary space on all indices of, and we use an agentic framework for this, just for full transparency, just for clarity, and also because it tends to do a better job than even a human would, looking at metrics like clinical relevance and completeness and factual accuracy, things that really matter to the clinician, significantly underperformed in products that are currently available today compared to models that are catered to the veterinary space. And I use this more as a reiterative point that I think benchmarks are going to be super important to provide clarity like this. And also, it's going to put onus on businesses to make sure they're posting their benchmarks. But I think in addition to that, we can freely allow veterinarians to choose what tool they want to use and why. And again, for full transparency, I'm actually working with 2 other individuals, including another person from our company. We are looking to develop the first platform that fully allows, sort of like a Hugging Face, but for veterinary teams, a data set that is publicly available, not downloadable, but that different companies can actually utilize for summarization benchmarks, for radiology benchmarks. And we're hoping to work with some of our colleges, like the American College of Veterinary Internal Medicine, as well as radiology and a few others as well, for this specific purpose. Because I personally think it's really important, but it sounds like everybody on this call does too.
So a couple of things. So one, in that paper, are you going to be publishing the names of the other companies?
No.
You can see how that might be a little bit problematic for some people, because
of course,
especially when people are looking for practical guidance. So I would encourage you to think about that. And especially if you do publish the name of the company, because you hinted at something where you said these are not built for veterinary purposes, which brings that list of companies who are coming into veterinary medicine from human medicine down to about 3 in my mind. Mm-hmm. So I probably know who the other 2 are if that is the case. But we'll leave that aside. Very small point. Can you just spell archive? Because it's not how normally people think about spelling archive.
Yes. ARXIV. And it's arxiv.org.
Perfect. The third thing, so we've been talking a lot about like wrappers and that sort of thing. And we went into it a little bit and then we sort of went off track. I think it's really important to note, pretty sure nobody has a large language model in veterinary medicine. That is their own large language model. And anyone who says that they have their own is probably lying. So I think it's worth just kind of reiterating that. And it's not as simple as you know this, it's not as simple as you either have a large language model on the back end or you're a wrapper around someone else's. There's a whole lot of other stuff that's going on there. And the pejorative term of being able to call it a wrapper, which I used a lot about a year ago when I was presenting on a lot of this stuff, it's not quite accurate, because there's a lot of stuff, like the depth of the wrapper is actually important. So what kind of pre-processing and post-processing are you doing? What other kind of validation studies do you have, like internally? For example, with Covet, we have 5 veterinarians on staff, and every time a new model comes out that we're looking at, then we've got a series of benchmark studies that we've done, and then we pull those in and say, is the model actually improving upon those before we actually go forward and deploy it into the marketplace? So I think it's a good call out to say, are people using large language models? And I don't know of any veterinary SaaS company that has $1 billion to build their own LLM. So it's unlikely that a company has its own LLM. But then, to get into some of the nuance there, like what actually are you doing in order to your point, provide safeguards for the veterinary profession? Mm-hmm. Because that pre-processing and post-processing after it's sent off to the LLM and then brought back, that's really important. And that's where a lot of the value is added. But it's not intuitively obvious that that's even happening, because a lot of the conversations that we have today are like, okay, so here's what a large language model is, and here's what it does, and here's the vectors that it's using, and all of these other things. And so you get into like really fine-grained detail really, really quickly. But as to your average veterinarian, they're just like, why are we talking about this? Just to kind of make that point that there's a lot of nuance that I think that we need to bring into the conversation when we talk about how large language models are being leveraged for this purpose. Something also I just want to highlight from what you've said that I think is also really important is that the degree to risk is dependent on the degree to which the veterinarian has control over the outcomes. Diagnostic tools, much higher level of risk, especially if somebody's leveraging a tool that they don't understand how it was built, they don't understand the training data, they don't understand a lot of exactly how it's being used. Scribing tools, co-pilot tools exist in this like kind of safer category because you can see what the input was and you can see what the output was. And then you can say, yes, this is an accurate representation of what's going on. And it's interesting. Like I've got tons of examples like you've had where, veterinarians like, well, I didn't even say that, right? And it's like, well, let's go back and look at the transcripts. And like, oh yeah, I totally did say that. So there's like these opportunities for helping veterinarians to provide even better medical records than what they have done before. And I think that that's really exciting. But yeah, so there's a whole mishmash of stuff. But I think that it's really important that we help educate people to understand that you can't ask the same questions of all companies and think that you're going to get a result that is going to provide you with the confidence that you need in order to use the product. Different product categories require different kinds of questions. And unfortunately, they do require a bit of a deep dive into what those categories are doing and the level of risk that's associated with the product.
I totally agree, Aaron. And I think I've got one question for you that I'll come back to, but I think on your more recent point about this idea that in theory, summaries, scribe tools are less risky than a radiology tool. And, that gets into the whole regulation piece around the FDA and their sort of software as a medical device, where we do have that categorical risk based on the potential implications to the patient. I guess in some ways I do argue that ultimately that risk comes down to the user using it. I think the risk for a scribe or summarizer tool is a lot less for a user that reviews those summaries, to Adam's point, and actually understands the fundamental differences. The risk to a user that goes on autopilot and just runs throughout their day and never actually looks at the record is the same way, basically the same level of education as somebody who didn't learn how to read radiographs. And so I would say the risk there is actually almost equivocal. So risk is proportional, I guess exactly what you said, proportional to the end user and the way the user is utilizing the tool. And I don't have an answer for this, but I guess in some ways that is maybe the basis of regulation, which is this idea that we need to have transparency, benchmarks, and results that people can fundamentally understand. One of the clear examples I give is accuracy is the worst bloody metric that has ever been developed and has ever been thrown out there, whether it's for a language model or otherwise. And, the example I always give is pretend you've got, and again, this is more for the readership than for you, or the listenership than you guys, but pretend you've got a cancer detection tool that says it's 95% accurate. But when you actually ask that company, what their data set actually looked like, you'll find out that they missed every single cancer case, but predicted every non-cancer case. But they're going to give you marketing jargon that says they're 95% accurate. So we really do need to focus on AI literacy in veterinary medicine. And I don't think there is enough of that. And I'm sure Ryan talked about it, but, I think education for the next generation of veterinarians is going to be really important. But to that point, I heard you say that Covet has had some internal studies, and I've asked this of a lot of big companies, IDEX included and Antech included. They just released stuff related to some of their rapid reads. They just released their new product that actually allows owners to scan teeth and say how much dental disease is there. I've posted on LinkedIn. I've emailed them directly. I've asked them and said, can you give me a white paper? Can you give me a single one-page summary of your benchmarks? Never hear back from them. So at what point are companies actually going to come forward and start giving data to the public and to our veterinary teams? Because obviously you guys have it, right? And other teams have it too. But how do we enforce that? How do we get people to share that?
Yeah, I think it's exactly what you've just said. Like, it has to be more than you asking for it, right? Because we only have a certain amount of energy that we can spend. And so what are the things that are important? And I think where we're at as an industry, when we think about scribing, is the education is not really caught up to the product deployment. And so people don't really understand. And so they're not necessarily asking the questions. They see that it's producing the results that they want. And like anecdotally, and I think it would be really interesting to do a study on this, we find that people spend more time editing their own notes than they do Covet notes. So when they go back and they review, they're like, oh, there's this one word that's spelled incorrectly, or this one small thing that's not done correctly. But in general, they're spending more time on their own notes. It's interesting. But I think if, as an industry, we started saying, yes, this is something that we're looking for, this is something that we want to see, then absolutely. I think what happens is back to a point that you made at the very beginning of this, where people get an outcome that they can trace because they see the input, they see the output. And so they get an output that they're comfortable with. And that's sufficient for them. They don't need benchmarking studies. They don't need regulations. They don't need a lot of other stuff. They're just seeing that the output is exactly what they're looking for. And then that's it. And to your point earlier, like, I've had one or two people say to me that COVID is so good that I don't even review my records anymore. And it scares the crap out of me when I hear that, because that sort of autopilot should not exist in any form of medicine, right?
Yep.
Like nobody should be doing that. And so the more that we can encourage people to say, yeah, like take a moment and review it. Even if it's got perfect results for years, like still review it, right? No matter what it is, no matter what product it is that you're using.
I think one of the things that could be really interesting as like a research is that at the end of the day, one of the things that people are worried about is ultimately, am I going to make a mistake that ends up resulting in a complaints or coming back to kind of bite me in the butt? And I bet you, if you looked at all the complaints across all the states for the last decade, most of the complaints are not necessarily about the wrong diagnosis or misdiagnosis. It's all the communication and everything else around it. Vets make mistakes all the time, right? Most of them do not result in a board complaint. And the reason is because people, they intervene, they over communicate, they adjust, they make other, things happen, right? But it's usually people's response to it and their willingness to meet the concerns or hear the pet owner as opposed to the very specific mistake that they did. And I think what ends up happening for the co-vets and for these dictation tools is that you end up having just so much more supportive tissue to be able to address and handle that, right? You have the proof of what you said. You're able to better reinforce coming out of the visit what was communicated, so you don't have those kind of broken links. You have better ability to summarize records, so maybe you don't miss things. And so it's really interesting because we talk a lot about, obviously, the accuracy of these tools, but for a lot of people, the value that they're getting, now that most of them are at a stage where they're like, good enough, or at least that I can tweak it for whatever good enough means for me. But it's like the experience around it. And it's less of like, do you have this capability? Yes or no, but like this feeling of trust and the frictionless experience and all these other things that are now kind of the real differentiators, I think, between these platforms, even though 40 of them kind of do the same thing. I think if you talk to people, they tell you they've had very different experiences if they've tried 5 or 6 of them.
Yeah.
But I do think, and I will commend you for this, because I think it is really important where even in light of the fact that these companies in different categories are having commercial success without publishing these benchmarks, it has to start somewhere. And it has to start with people communicating why this is important. And yes, we can make a lot of excuses or a lot of like circumvent why that's not useful. But I think one of the things that I've always admired about you and Ryan is that you guys saw that this was important very early on and took meaningful steps to bring that conversation to the forefront, even though it might not have been the sexiest thing to talk about or the thing that people wanted to. So Ryan with the special issue and kind of publishing, starting that conversation in radiology and trying to be that bridge, obviously you in oncology. And I think what will happen is when more specialists see that this work is important, they're going to ask these critical questions. It's going to open up new use cases. It's going to lead to higher trust across the board. And I do think the future depends on really productive, aligned, constructive relationships with a specialty community.
The first one I'd say is, who says the veterinary AI brief can't be spicy? I mean, my goodness, we had some fireworks for you here today, the listener. I know, Aaron, one of the nicest, smartest dudes I know, genuinely, and Chris, who is obviously an intellectual heavyweight. That was as close as you will see two incredible dudes come to blows, as you will probably witness in the veterinary industry. So amazing. I already see them texting each other, waiting for each other in the parking lot. Going to be phenomenal. What I'd love to do here is just do a roundtable of takeaways. If there's something that you want the audience leaving really solidified going forward, because we covered so much, and we're going to do some editing, but my goodness, there's only so much our poor producer can do. What are those takeaways for you? And Chris, let's start with you.
The first is never go to bat with Aaron, because he'll probably kick your ass in the parking lot. But no, I'm just kidding. But I think what I really hope people take away just from this conversation, which honestly has been super stimulating for me, and I think between some of the work that, and I want to call this out, the ACVIM AI Task Force is actually very soon hoping to have a solidified publication that actually gives some guidance to the ACVIM readership, should be available publicly as well, on basically grading tools and looking at tools. And it's not a validated system, but it is a scoring system to give people a baseline to jump from when it comes to evaluating tools. But what I'd really love to see, and what I hope this encourages people to do, is people like Aaron and I to go grab a beer some more and actually work together as teams. And I think from the commercial space, because I don't think the regulatory or academic space is going to work at a fast enough pace to come together for these benchmarking tools. And that's a call out to all of the software developers out there and the teams that are really passionate about the veterinary space.
I think for me, the biggest takeaway is implicitly Chris said that he didn't want to have a beer with Adam because he did say he wanted that one thing. So I think for me, that's a big win. Yeah, I think we're all pushing in the same sort of direction where we're all like trying to educate people more and get people more aware of like not just what the tools are, but how to evaluate them, how to get to that level of comfort. And there is this like steep learning curve that's associated with it. And I don't think, to be completely honest, there's not really great resources that currently exist for people where it's like, here you go, here's a 101, here's a 201, here's a 301 version of that. And I think that's kind of a call out to everyone is to like, we need to be having more conversations about this stuff. We need to be asking more questions. We need to be humble about the fact that we don't really understand. Like, I could talk about like vector databases and blah, blah, but like, do I actually know what that means when it comes to LLMs? Like, not really. But that's okay. So people having a particular level of understanding relative to what needs to be deployed in their practice. And I'm just really looking forward, Chris, to reading more about the stuff that you're putting out there, because I think oncology in particular, we started off with radiology, then we went into scribing. We're into different like image modalities right now with AI, and oncology is something that I think is going to catch up really, really quickly. And it's going to be really exciting to follow people like yourself and the work that you're trying to do to help people understand this space better. So appreciate my big takeaways.
I think there's kind of two. One is that I think this conversation reinforces a point that I've long held, which is that veterinarians are in a really great position to kind of co-create that future. And you hear about the kind of the small teams and this interest in oncology that's spurned, a company and this more critical work that's being done for the future of that specialty in the profession. I think it's really important that veterinarians see themselves as drivers of that future and can actively contribute to it. And that's really positive. And with that comes, I think, a much deeper appreciation for the current state, the pain points, the workflows, what the patients and clients ultimately are looking for. The second is kind of like the compounding nature of a lot of this stuff. So I think in our last couple of conversations, Chris, oncology more so than any other field, I think, is poised to change dramatically in like the next 5 years. And you sort of talked about, hey, all the way from the most cutting edge therapies coming out from human health to what that means for the general practitioner and what it means for the client relationships. And it's kind of like, wow, this is all going to start to really have this positive feedback loop where we're going to be able to have more pets that are diagnosed properly earlier on. That's going to lead to new models of intervention, new specialty models, new business models. That's also going to probably accelerate the need for more advanced therapies and more interest in kind of the next generation of diagnostics and therapeutic solutions. It's an incredibly exciting time, but I think it also reveals how significantly the scope and kind of what we associate with like veterinary medicine will change in the way that like, if you're a veterinarian bloodletting, so 100 years ago, you look at veterinary medicine today, like you wouldn't recognize it.
So the conversation has just been scintillating and fascinating, Chris. I think one thing that, especially what you and Aaron did for us in our audience is really raise the level of AI literacy that we have, at least, in these practical applications. And that's what we're trying to do here as a show is we're saying, listen, this is a wave that's coming. The curve is exponential, so it's hard to understand the implications of what's coming down the pike in just like 2 years, right? And so it's just so important to quickly become AI literate and to understand the implications and applications here. The takeaways for me, and I always try to approach things from not getting too far over my skis. So as a pet owner and as somebody who runs like the marketing and comms company. So the first, I thought your analysis as to what AI is going to do for personalized cancer care is absolutely fascinating. And the takeaway for me is, as a pet owner, I very much want my vet to be in the loop about what's happening there. Like, honestly, so what kills older pets? It's cancer and it's organ disease, right? And so if you are able to make substantial gains in one of the biggest threats to Lula or Winnie's health, like, that's a serious differentiator and a lot of perceived value that's created. And as pet owners become more aware of what AI is doing for personalized medicine in both human and animal health, they're going to start to expect and demand this of you. And so I think there's a real lesson here that GPs, oncologists, everyone really needs to familiarize themselves with what's coming down the pike, just so that you can have these thoughtful conversations with pet owners who are going to start expecting that of you. The other thing that I think was really, really interesting was the conversation between you and Adam around how the model will change, and specifically how that pertains to accessibility. I think we as an industry have a tendency to think so small about what the real value is that we're providing and how to think first principles, like, to provide that value. We don't have nearly enough capacity right now or accessibility to care for all the pets in America, let alone all the pets in the world, right? Like, total addressable market is orders of magnitude larger than what is currently being addressed. And so I think this, like, rising tide to me is going to be really, really critical, not only in terms of how personalized we can get medicine, but how distributed we can make medicine. Like, how we could perhaps be gathering context from pets and pet owners around the world, leveraging our unique expertise. Like, what humans are tool users, right? Like, that's what has always defined us. And, the ability for us to use this tool to drive order of magnitude gains in accessibility is, to me, really exciting. So a big thank you to you, Chris. I will unfortunately be off next week, leaving this in the very capable hands of Adam and Aaron. I'm going to be unveiling the secret project I've been working at for the last 2 years at VHMA. So if you're out there, please do, come say hello. Tell me why you like me more than Aaron and Adam, and share some feedback as to what you've thought of the show so far. And ending this with a big thank you to you, Chris. Like, this is incredible, and I can't wait for our audience to hear it.
Likewise, and really appreciate the opportunity. And honestly, we should do this more, just in general. Virtual beer, but just with Aaron, not Adam. Just kidding. As it should be. Really appreciate it.
Thanks,
All
Chris.
right. Signing off with the Veterinary AI Brief. We'll see you next week. Thanks, everyone.
Thanks, guys.